as president of the Guild of Medical Directors, which is a pretty high position. You're president of the Guild of Medical Directors. What is the conversation that you guys have when you're sitting down and talking? Are you looking more at policy, interfacing with government on policy, or are you looking more at your incomes? What can we do to make our profession more profitable to us? What are you guys looking at?
We're looking at all of the above, I would say.
Yeah.
I understand. Because firstly, you know that as medical practitioners, we have to survive economically in this very harsh, sort of climate, and we have to, sort of fend off people who want to tax us into oblivion. You get to the point. But at the same time, we're privileged to actually engage government in terms of policy.
Yeah.
And I must say that I'm very happy that the federal government recognizes the Guild as an entity with which they can engage.
Yeah.
And we are involved in so many, areas. For instance, just this afternoon, I got an invitation from the National Primary Health Promotion Agency.
Yeah.
A development agency, I think as they're called, that they wanted us to come to a workshop in Lagos.
Okay.
And I was to nominate 3 of our members to participate in that workshop on immunization policy.
Okay.
And there are various other areas in which we engage. I think there was another one we held which had to do with the maternal mortality.
Yeah.
And so we do engage with government, particularly in areas of policy development.
Yeah.
And of course, we are also represented on the board of the National Health Insurance Scheme. I happen to represent the Guild on that board.
Yeah.
And of course, you know that the NHIS is really geared towards, providing health to a vast number of people at an affordable cost. And so
that is the National Health Insurance Scheme.
Exactly, yeah.
Are you a member of that?
I'm a member of the board of that, yeah.
Okay, and
So,
I was facetiously asking you, but seriously speaking, even before we came on, isn't that just for civil servants? I'm a private person out there. I'm a farmer. I'm a businessman. Can I be a member of the? Can I get insurance through that cover?
Technically speaking, as we speak, you can. But I have to say that at the moment, most of the people who have covered have been the federal civil servants, people who work in the MDAs and so on and so forth, and who have no choice but to be covered. Because it's like
it's mandatory.
It's mandatory for them. So, but we are the board, the current board of the NHIS is a very proactive board.
Okay.
Led by Dr. Ifedne Nyantu, a very remarkable woman, if I must say so. And we are actually actively looking at ways in which we can expand coverage. We're not proud of the coverage we have at the moment. We want it to be possible that every Nigerian, every man on the street will feel that this is the way to go to get insurance, so that they can be treated completely for whatever.
When you say completely treated of what? Of malaria and typhoid?
Everything.
What if it's something
malaria,
more serious?
Typhoid, cancer.
You need heart
delivery, heart transplant. That is what we're aiming at. So that once you are insured, you are sure that whatever ails you, you don't need to do out-of-pocket payments anymore.
Yeah.
And that is precisely what we are aiming to do. This present board of the NHIS is aiming to achieve.
Can I lead to overconsumption of medical care? Being that you have probably less than 80,000 medical doctors in the whole of Nigeria. Only 80,000 medical doctors in the whole of Nigeria. If we have this kind of insurance and it's available to everybody, would we overconsume medical care? Would we overwhelm the medical system and the doctors?
I don't think so, because at the moment, while it is true that we have only about 80,000 doctors, not all of them are even in active practice, I must say. You probably have about the same number outside the country.
That's another serious
so
problem.
There's a lot of brain drain in that area. And then secondly, it's not as if Nigerians are not accessing healthcare anyway, but they are accessing healthcare paying out of their pockets, mostly.
That is, the well-to-do Nigerians are accessing healthcare. But the little guys in the village, can they even come up with 1,000 naira to pay to something? If somebody came to your facility, I'd be hard pressed to see how they even get to your facility.
Well, I have to say that our facility is open to the rich and poor.
Yeah, but the poor cannot pay.
We have ways in which we can.
Unless they have insurance.
Yeah, that is the whole point, to encourage people to get insurance, because once you have insurance, then the risk is spread out. Yeah.
Is there a policy that we can put in place? Those of you that are talking to the government, with these meetings you have with the Ministry of Health and with people in the government, is there any policy now underway or that already there in place where we can use to coax our doctors back, at least to in partnership, even if they go back after they do whatever they do?
Well, I cannot say that there's a particular policy, to coax them back. Yeah. Certainly not. But I do know that there are partnerships that are going on in terms of some doctors based abroad coming home to participate in.
A lot of them are just coming on their own.
Yeah,
because they just want to
give back.
Yeah,
exactly. That is precisely what I was about to say.
But we don't have policies at the local government level, at the state level, or whatever level to say, hey, this is a program for bringing.
Not that I'm aware of.
And it's extremely essential. Health is that critical, and we don't have the technology. We don't have the facilities to the extent that we want, or the brain power to the extent that we want. But these guys get a little bit more outside because, you were mostly also trained outside, spend time outside. We don't have the technologies that they have.
Totally not.
We need to find a way to let them come and participate in what we're doing.
Yes, I think the first challenge is for us to overcome is to build world-class facilities.
Yeah.
If we build the world-class facilities where they can get to do most of the things they're used to doing outside, they certainly would. That is one big obstacle that, we have already overcome for them.
And I just to round up here, just a couple questions. One, first is with integration of the various practices in the country. Medical practices, especially public and private, whether there is any sort of integration. So where if I'm not that competent in some area, I can refer a patient to another facility, whether it be public or private. Is there really such a thing in Nigeria?
Well, there is, but the integration is not really there. There's too much of a silo mentality at the moment, and it's like we have this mentality that private is private and public is public. Whereas if you look at the situation in the UK, I think we need to make a case study of that. Whereas you have every right to set up a practice, in the UK, you're immediately integrated into the NHS. And whatever you do is open to the health administration.
So the NHS is the National Health System.
Yeah, the National Health System.
Okay.
So whatever patients you see in your practice is known to the National Health System.
Okay.
There's no privacy, particularly now that everything is computerized. You understand? So, and of course, every citizen has, what they call, I don't know what they call this card again. There's a card they give to every patient.
Okay.
NHS card.
Okay.
Whether you are private or public or whatever, that NHS card is there.
Yeah.
And if you are registering with a private hospital, your NHS number is already written there.
Okay.
And what your problems are is already integrated. And of course, everybody in the UK is encouraged to have a GP.
Okay.
So even if you are going to that's a general practitioner.
Okay, yeah.
And we really have enough doctors and practices in this country to actually run that kind of system, so that nobody should need to travel more than 5 kilometers from his house to have a GP.
Okay.
So you shouldn't need to go and queue up in a teaching hospital for hours for you to treat malaria or for you to treat diarrhea and vomiting. for you to treat typhoid or for your child to get immunized. You understand? So that kind of integration is extremely important. And it's one of the things we're looking at in the NHIS board, whereby we're saying, okay, the registration, the capturing of patients of enrollees into the NHIS is actually done at the level of the local facility.
Okay.
So basically, you're living in Asokoro now, for instance. There's a GP just down the road from you.
Yeah.
That should naturally be the place where you register for your general practice. You understand? And of course, the only duty of government to ensure that that GP meets certain basic standards and they can do certain basic things. That when you are going there, you have the confidence as a patient that, okay, I'm going to this facility, it's as good as any other GP.
Yes.
And that GP is linked with maybe Asokoro General Hospital, and maybe they are linked with, the Asokoro General Hospital will be the natural choice for them. That will be their secondary and tertiary care facility to which you are also linked. So that within Asokoro, you know that you are well taken care of.
Yeah.
You don't necessarily have to go to Asokoro Hospital to go and line up for ages before you see a doctor.
Professor, thank you so very much.
Thank you.
You are wonderful. Great job.
Thank you for having me. Thank you very much indeed.
Thanks.